A very good afternoon to all of you. I, Dr. Nilesh Balkawade, Clinical Head at Oasis Fertility, Pune. Welcome you again to today's FB Live session. And here we are going to talk about some newer inventions in fertility, and that is cryopreservation, aptly called as store your future. Can we have the PPT, please? So, as aptly said, store your future. You can, and if necessary, you should know about this newer technology of cryopreservation, where you're able to store your gametes, the ovaries, the oocytes, sperms, and even the embryos to be used for future. Man has always been storing and preserving things for his use in the near future. And if we see, the water is stored in preserved in the dams. We store food articles in the form of pickles, jams, and so on. We even store the science of human way back in the Stone Ages in the form of fossils. We have the Egyptian mummies being stored. There is a cryopreservation of whole human body which is being thought of, and man is also thinking of storing his own brain. We also know the famous scientist Albert Einstein, the research on whose brain is still going on. So we know that this feature is constantly expanding, and the preservation is always being alluring to the human being. And this is a vast field which is coming up in a great way, which is called as cryopreservation. What is this cryopreservation? So basically, we can store cells of human by a newer branch of science called as cryobiology, and this can be done in a very cold temperature of minus 196 degrees Celsius in a liquid nitrogen tank. What all can be stored here? So we can store the oocytes, that is the female gametes. We can even store the complete ovaries or the ovarian tissue. This is called as ovarian tissue cryopreservation. We can store the sperms, that is the male gamete, and if required, we can even store the testicular tissue. Above all this, if we prepare an embryo and if we prepare a baby out of mixing of the egg and the sperm, which we call as embryo, at this stage, we can store the embryo in the form of cleavage stage embryo or a blastocyst embryo. Both these types of embryos can be preserved, cryopreserved for future use. So if you don't want to get pregnant right now, you can just prepare your embryos and cryopreserve them for a later use. Now, why there is a necessity of cryopreservation, and why humans have started using it more and more, and what is the thing behind this, we'll understand. But the first question which comes to our mind is this cryopreservation safe? Now in this picture, as you can see, the warm environment will protect the cells, and that's why we have the human body temperature at 37 degrees Celsius, where the cells are preserved in the normal format. So if we can see the superior line in your picture, where the blue colored cells, after in cold temperature, they'll have the cold shock and the cells will shrink in size. Later on, in a very cold temperature or a frozen temperature, the cells will be shrunken to an extent where they can get damaged. So is the apprehension really true that cold will damage our cells? I think it's not so in the current scenario, where humans have used what is called as cryoprotectants, which will preserve the architecture of the cells. So in the lower picture, where we can see the cells in green, where the warm environment, the cold environment, and the very cold environment. In all these three types of environment, the cell structure remains as it is, and this is because of the magic of use of cryoprotectants. Now there are these different kinds of cryoprotectants which we can use, which can help us to preserve these cells. A common example which we can give is heart transplantation. Sometimes a heart is transplanted from one city to the other with the help of green corridor. We stay in Pune and we have seen heart being transferred from as distant as Chennai. So all this is the magic of cryopreservation and the cryoprotectants. Some cryoprotectants which are commonly used are the glycerol, dimethyl sulfoxide, polyvinyl pyrrolidine, proline, dextran, ethylene glycol, propylene glycol, and other sugars. All these cryoprotectants, more they are used, they will lower the freezing point and therefore prevent damage to the cells. As we know that water can form ice crystals inside the cells, and this crystallization and damage to the cells is also prevented by the use of these cryoprotectants. What are different techniques of cryopreservation or maintaining the cell architecture? So we have something called as slow freezing and something called as fast freezing or vitrification. Slow freezing is a gradual process which takes place in around an hour or 2 hours time, with lower amounts of cryoprotectant being used and greater chance of crystalloid formation. Eggs thawed for fertilization can be by this technique, whereas a flash freeze or freezing in 5 to 10 minutes procedure is called as vitrification or fast freezing. Higher amounts of cryoprotectants can be used, less chance of ice crystal formation in this technique. So these are the two different types of techniques which we can use for cryopreservation. Why do we do cryopreservation? What is the need of doing this cryopreservation? Are we doing some unnatural things? We have seen that it's very much safe and we very much protect the cells, we take care of the cells. The revival of these cells after they are thawed, that is, they are brought to functioning again after being cryoprotected, is called as thawing. And this thawing process has almost yielded very good results. For embryos, the thawing yields near to 100% results. For sperms, it yields more than 50 to 60% results. And same is this thing with oocytes. So what are the indications for doing sperm cryopreservation? So if a husband cannot produce sample on demand or can't be present on time for the procedures such as IUI, intrauterine insemination, or IVF or in vitro fertilization, then sperm freezing can be used for a temporary basis. If a man has got severe oligoasthenoteratospermia, that is the sperm count, motility, and morphology are all at stake, and we think that this man can land up in azoospermia later on, then also as a safety measure, we can preserve the semen as semen freezing. Sometimes a man can have different debilitating illnesses in the form of different forms of cancer, where chemotherapy and radiotherapy may have to be used. A radiotherapy, if it is localized, there are less chances of damage to the gametes. But if it's a testicular tumor where there are high chances of damage, then that can also affect. But chemotherapy, yes, chemotherapy anywhere for any cancer inside the body can cause toxic damage to the testicular tissue and the testicular cells, and resulting in later on in oligoasthenoteratospermia or azoospermia. So there's different forms of cancer and cancer treatments. Before that, the semen can be preserved. Other debilitating illnesses in the form of connective tissue disorders, sarcoidosis, or other diseases which are impacting the sperm function, or any medications which are impacting the sperm vitality, in all these conditions, the sperms can be cryopreserved. Post-mortem preservation of sperms is an argumentative issue. However, if a person has given a validation or consent for sperm freezing or testicular tissue freezing after his death, or use of that sperms and testicular tissue after his death, this can be done. Now we'll come to female gamete freezing or oocyte freezing. It can be again done in the form of variety of cancers which need chemotherapy and radiotherapy. It can be done prior to organ transplant in the form of liver transplant or bone marrow transplant, where cytotoxic therapy has to be initiated later on. In cases of PCOD or polycystic ovarian disease or polycystic ovarian syndrome, there are, and these patients undergoing IVF or ART techniques, there are lots of eggs which are stimulated, and so we can't transfer these immediately, and therefore there may be a necessity of doing oocyte cryopreservation in such cases. Single woman who is not married, or who is married, or women those who are married and those who don't want children immediately, they can go for oocyte cryopreservation. This is called as social egg freezing. So for social reasons, they might have to go for egg freezing. In cases where male partner fails to produce semen sample on the day of IVF, after egg pickup, and ICSI or IVF needs to be postponed, in such cases, we have option of oocyte freezing. Sometimes oocyte freezing is not possible because stimulation for removing these oocytes is not possible. In that case, we can do what is called as ovarian tissue cryopreservation. So small pieces of tissue contain very large number of primordial follicles and can be stored for children as well as young adults. So laparoscopic ovarian biopsy and oophorectomy can be performed for those who are undergoing cancer treatment, chemotherapy, anytime during the menstrual cycle. Thereby, we can avoid delay for the process of stimulation. So in this, even where the stimulation is not possible, like in cancer patients, if you want to go for a cancer treatment immediately, or in young adults where stimulation is not possible in children, in this case is laparoscopic retrieval of ovary completely or ovarian tissue can be performed. Then that tissue is prepared and the cortical tissue is taken and separated, and it is frozen, and primordial follicles can be removed from this tissue, and by a technique called as in vitro maturation, these small primordial follicles can be converted into mature oocytes which can later on be used for making a baby. Friends, we all know that we day by day we age, and every birthday is a different one. For females, graceful aging is very important. So many do age gracefully, but our internal organs are definitely being affected. At birth, the number of oocytes present is in millions. This millions reduces to some lakhs at the puberty. Later on, in the whole lifetime of a woman, the number of oocytes being utilized is around 400. As the age is going to increase, the number of oocytes are going to decrease. After the age of 30, there is slight decline in the oocyte number, which drastically increases after the age of 35. So 35 is a bar for women for childbearing, after which the success of a natural childbearing might go down. The success of fertility treatments might also go down because of decreased egg number and the egg quality. Late marriages, late childbearing, importance to the profession which we are doing, maybe be a sports or other careers, other commitments, can lead to a late childbearing and late marriages, and therefore there can be fewer eggs. Also, in this environment of growing pollution, increasing addictions in the form of smoking, alcoholism, or drugs, the gamete number is going down before the age of 35. So this we call as premature ovarian insufficiency. So if the egg count is severely affected before the age of 40 and it comes to the level of menopause, we call this as premature ovarian insufficiency, and this can affect women in a greater sense. So That is the importance of freezing the eggs at an early age. So those women who want to go for late marriage, late childbearing, have their professional importance and commitments, these need to freeze their eggs as early as possible. And this option is available. Other than this, cryopreservation or freezing also helps us to preserve embryos. So we have seen about gamete freezing, the sperm freezing, and the egg freezing. We have something called as the embryo vitrification or embryo cryopreservation. Why do we need to take this embryo cryopreservation? So suppose the embryo number which is produced during the artificial reproductive technique, this is more. The supernumerary embryos following a fresh embryo transfer can be cryopreserved. In case of ovarian hyperstimulation syndrome, we will not transfer the embryos immediately back inside the womb, and this is where we need embryo freezing. Any point where we feel that the implantation process can be jeopardized, this is the time where we go for embryo cryopreservation. Too thin endometrium or too thick endometrium is where we also think of doing embryo cryopreservation. If there is any fluid in the endometrial cavity, any bleeding, or a polyp or a fibroid present in the endometrial cavity, in all these scenarios, we'll think of cryopreserving the embryo and remove that cause or remove that problem and then go for a transfer which is called as a frozen embryo transfer. There can be situations where the embryo transfer can be difficult. Preservation of fertility for future offsprings is important. These are the cases where we also, in these scenarios also, we go for embryo cryopreservation. Sometimes for embryo donations and for research purposes, we also need to do embryo cryopreservation. So friends, this canvas is bigger than we think of. And the current focus in ART is to improve techniques for better success rate, decreasing the treatment cost, and preserving the fertility potential of young individuals. So for all this, I think cryopreservation is the need of hour, and there is a long way to go to explore much greater avenues in regard to cryopreservation. So one should get off the old road to find a new one. I think new roads can lead us to some newer destinations, and this can be fascinating. So sky is the limit for all these technologies in IVF, and cryopreservation is one such evolving technology of IVF. At Oasis Fertility, we are practicing all forms of cryopreservations which we talked of with the latest advanced technology, with the experience behind all this. So with all this, I urge you to please store your future before it's too late. Thank you so much. Thank you for your patient hearing. And if you like this video, please share. And we are available at Dynasty Commercial Wakat for any of your queries. This is our number for any consultations, any online consultations needed. So you can contact us anytime. So now I'd like to take some questions.
There's a question, sir. How long can we do the cryopreservation?
Okay, thank you. So how long can we do the cryopreservation? It's now being validated that cryopreservation short term can be done for few days till we achieve what we want. Like for embryo cryopreservation, if the transfer scenario is not good, we can do the cryopreservation for a few months, maybe 1 month or 2 months. But if the need of the hour is to cryopreserve the embryos or the gametes for few months, not only few months, but few years or many years, that is also possible. Recently, we had a pregnancy which was by a cryopreserved embryo, and the embryo was preserved for as long as 15 to 20 years. So this is the thing, the embryo cryopreservation technology, as it goes on advancing, we'll see the effects of it. And we have seen currently that the cryopreserved embryos doesn't have any problem whatsoever, in the aspect of its results, in the aspects of effects on the baby or the mother. All are favorable.
Just one more question, sir. Do all the cryopreservation techniques need surgical retrieval of the gametes, or is it normal?
Yeah. So for males, we can take a semen sample, which can be collected by masturbation. But for females, we have to go for a minimal invasive surgical technique or a simple surgical technique such as endoscopy for cryopreservation. Like if we stimulate the ovaries, we can remove the eggs by a transvaginal sonography guided ovum pickup procedure, which is a simple one. In the cases where we can't go for ovum pickup procedure, we can do a laparoscopic ovarian tissue removal or laparoscopic oophorectomy, which is again not a very highly invasive procedure. It's a minimally invasive procedure. So by these simple techniques, we can do cryopreservation.
One more question. Are all the embryos normal which have undergone cryopreservation? Those are conceived by the pregnancy after the cryopreservation.
Yes. So all the embryos which are cryopreserved are later on thawed. That is, they are brought to their normal function. And after thawing, we check for the embryo survivability. Most of the times, like we said, that the survivability is very good if we have very good cryopreservation techniques. At Oasis Fertility, we have very good survival of these embryos. So their survivability is checked, and their expansion is checked. If a laser is performed, we can check the expansion of this blastocyst, and later on they are transferred. So a very good survivability and a very good success rate is seen by these embryos, and these don't cause any problems whatsoever. They behave as same as fresh embryo transfer.
One last question. Hello, sir. Can you hear me?
Yes.
Yeah. So, do all the hospitals or facilities offer these kind of facilities? Cryopreservation.
Yeah, I think as science is advancing, all should offer. I don't know whether all are offering or not, because the basic IVF center may not offer you cryopreservation techniques. But a good IVF center, which is a tertiary care IVF center, should offer you not only cryopreservation for embryos, which is done routinely, but it should offer you cryopreservation for oocytes as well as the sperms if necessary, because this is a need of our. And here at Oasis Fertility, we are offering all forms of cryopreservations along with other latest advanced technology under one roof, under all centers of Oasis Fertility.
Yes, sir. We are done with questions.
Yeah. So thank you all for your patient hearing. We welcome you all for any of your queries to address them online through our online platform. You can note down our numbers for that on the screen. Offline, if you want to visit us, we are available in Pune and other centers of Oasis Fertility all over India. At Pune, we are placed at Dynasty Commercial, Chhatrapati Chowk, Wakat, where you can visit us by taking a small appointment in these COVID times. Along with that, we offer you all fertility-related services along with cryopreservation. So you can reach out to us at Oasis Fertility, Wakat. Thank you for your patient hearing. I, Dr. Nilesh Balkawade, sign off for today. Thank you.